Hello, everyone. Good evening. I hope that you can hear me tonight. Welcome to our nursing prioritization and delegation session again. It's Thursday, and it's going to be from 7 to 8 p.m. if we finish the whole hour. But anyway, thank you for being here tonight, everyone. How are you doing, guys? Everything is okay? Let me see the comment section. Okay. All right. So let me see if everybody can hear me. Okay, so we have a lot of people signing in tonight. Okay, so we have Julie. So hi, Julie. Good evening. We have Pratiksa Patel also for tonight. We have Liza Sibayan. We have Gian Torres, Albert Thompson, Joanna Manalang, Luz La Rosa Sagayaga, Mimco Sasi Coca-Cola. Okay. Aurora Fiesta. Also, we have MJ Enriquez. Also, we have Makita Dorothy and Jemlyn are watching tonight. So we have a lot of people for tonight, everyone joining us. So thank you very much. Again, my name is Mr. Alan Matus, and I am the a nurse educator, and I have been teaching for almost 25 years, and I have been helping out students pass their NCLEX. And also at this time, I'm a nursing faculty. I help students also pass their nursing program. And then also I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. I also have my book in Amazon. Okay, so that's my book. I'm an author and I published that. It's titled Simple, Fast, and Easy NCLEX Review. Okay, so hopefully you grab a copy. And one of the updates also is we might be having the book available also in our website soon, in our website. And it's possible also for you to order a signed copy of the book. So I'll be signing the book if you want to have a copy. So wait for further announcements regarding that. Okay, so hopefully you get my signed copy, everyone. That would be exciting. Okay. All right. So again, for tonight, we have prepared your questions on nursing prioritization and delegation. Okay. So what's our agenda for tonight? Let's go direct to the point, everyone. But before that, let's see. Okay, some special messages from our students. So we have Theophane. She said, hello, everyone from Virginia Beach, Virginia. So nice to see you here tonight. Okay. Very good. Okay. So let's proceed to our agenda. So for tonight, we have the motivational photo of the week. Okay, so we have this special merchandise T-shirt we have. It's an inspirational T-shirt. If you want to get an item, you know, it's available in our merchandise website. I will put the link in the comment section so that if you're interested, I think it is around $29, I guess. But it's all about positive thinking, and really making sure that when you are reviewing for your NCLEX, you are totally focused and avoid negative energy. Just always think that you can do it. Okay, you can do it, and nothing will stop you from achieving your goal. So again, that is our merchandise product. And also recently, we have revised or updated our merchandise website, so you can see the actual photo there if it's in a cell phone. Okay, so it comes in different colors. We have blue, we have gray, we have orange, and of course there's a Matus Nursing Review logo, of course. Okay, so thank you very much. If you're getting one, thank you for supporting our online NCLEX Academy, everybody. Thank you. Okay, all right. So the next one will be, of course, our free 90-day online access NCLEX review. So let's see who will win tonight. So we will announce the winner at the end of this program. Okay. So if you also know some people who passed their NCLEX already, or you passed your NCLEX already, let me know so that we can congratulate you here and give you a shout out in our program. Okay. All right. Okay. So let's see. All right, so Amber Liu said, so Jemlyn said, nice color. Yes, it's a nice color, Jemlyn. Yeah, I really like that shirt, actually. Yeah, I'm gonna show you the sweatshirt when it arrives because I have a sample of that, and it says, "I can do it, and nothing will stop me." So you have to announce to the whole world your 100% motivation to pass your NCLEX, okay? And nothing will stop you. You have to remind yourself every day, that you can do it because it's entirely possible, right? Okay, so everyone, I would like to ask if it's possible for you to share this in your timeline or also share with your friends. If you're watching in YouTube, then please click subscribe so that you always get the updates on regarding our new videos on prioritization and delegation, everyone. Okay? All right. So what are you waiting for? Click that share. Okay? All right. Okay. So let's see who are the people tonight. So someone commented, okay? So Amber Liu said, yes, avoid negative energy. Go for it and chase your dream. Definitely. I always tell students that when you prepare for your NCLEX, you have to think positive, okay? Give your 150% in reviewing for the NCLEX and do not entertain any negative energy because you don't want to get distracted from reaching your goal, which is to pass your NCLEX. Surround yourself with positive people. Surround yourself with people who will support you. Surround yourself with people who will be there for you to push you if you feel lazy, if you feel down, if you feel depressed. So surround yourself with people who will be there to support you and reach your goal. Okay? So very important. All right. So thank you very much, Play. Thank you. I miss you also, everyone. Okay. I cannot wait to see you every Thursday. I'm always excited. Okay. So for tonight, we're gonna have your first question for tonight. We have your NCLEX questions on prioritization and also your delegation, everyone. And I know some of you are praying that you will win the 90-day online NCLEX Academy. Well, we will see. Maybe one of these days you will finally win our promo. Okay. So someone said, I love the pink color of the shirt. Well, so grab your copy, okay, or grab your item regarding the sweatshirt. I'm so excited with that sweatshirt actually because it really looks very nice and it's, the color, okay? All right. So I would like to see you get one, all right? And let me know if you got one. I want to see a photo, okay? Because I ordered already for myself. So, and maybe one of these days we're giving away sweatshirts. We don't know. But for now, you can go to our merchandise website, okay? All right. So, everyone, are you ready for the first question for tonight? Without further ado, I'm going to have the first question on prioritization, okay? Let's see. So Trini Lee said, pink is my favorite color. Very nice. So that was pink color. Okay. All right. Okay. So for tonight, we have the first question. Okay. How do you win or how do you get the giveaway? Free 90-day online NCLEX Academy. The fact that you joined the program tonight, okay, your names will be entered into a list and it will be combined in the website, and whichever name first appears on the list, then the winner is the winner of this program, okay, of the raffle. However, what I'm going to do later on is take a snapshot of the winner tonight and maybe put that in the comment section so you can see. Okay. All right. So let's have the first question tonight. Ready? 1, 2, 3. Let's see if you're ready for the first question for tonight, everyone. Okay. Okay. Question number 1. The nurse is assigned to the following clients after the change of shift. Which of the following clients needs to be assessed first? A, the 55-year-old client who complains of ringing in the ears while receiving vancomycin. B, the 33-year-old client with stage 4 left ankle pressure ulcer who needs a wound culture. C, the 47-year-old client who has a potassium level of 5 before hemodialysis. Or letter D, the 28-year-old client with advanced lung cancer who reports that the PCA pump is not working. Okay, again, the nurse is assigned to the following clients after the change of shift. Which of the following clients needs to be assessed first? A, the 55-year-old client who complains of ringing in the ears while receiving vancomycin. B, the 33-year-old client with stage 4 left ankle pressure ulcer who needs a wound culture. C, the 47-year-old client who has a potassium level of 5 MEQ per liters before hemodialysis. And letter D, the 28-year-old client with advanced lung cancer who reports that the PCA pump is not working. So who do you think will be the priority in this situation? And I would like to see your rationale or your reasoning why you chose a particular answer. Okay? All right. Okay, so remember, you have to analyze the question very well, and which patient has a situation that is not expected. Okay? Which situation is not expected, everyone? Okay? All right, so this, I always told students that when you answer questions, it's very important really to be well-rounded in the NCLEX, because in the NCLEX, you cannot be selective only of the concept that you want to learn. There are, of course, core concepts. However, you need to learn as many information as you can, because in questions like this, you need to be able to eliminate as many options as possible. Okay? All right. What's the answer, everyone? Okay, so let's find out who is the most unstable patient, or which patient is in a serious situation. Okay? Which patient here is in a serious situation? Is it A, B, C, or D? Okay? I will give you an option now, I will tell you that the answer to this question is not letter D. So it's either A, B, C now. Okay? So the answer to this question is going to be letter, what do you think, everyone? Okay. So the answer is going to be letter A. So A is the answer, everyone. Why is letter A the answer? Because letter A is an adverse reaction to vancomycin, especially if it's persistent. Okay, so remember that vancomycin is an example of an aminoglycoside antibiotic. Okay, aminoglycoside antibiotic, which means to say that a common adverse reaction to aminoglycoside antibiotic will be your ototoxicity and also your nephrotoxicity. So ringing in the ears or hearing loss are indications of ototoxicity. So it could indicate that there is damage to the eighth cranial nerve, which is your auditory nerve. So ringing in the ears, and also for vancomycin or gentamicin, for example, which is another aminoglycoside, you have to check also for kidney function. So letter A is the answer, because you want to find out what's going on. And if ringing in the ears is really present and you report that to the doctor, we really have to hold the medication. We should not give that, because that's your ototoxicity. So remember that your streptomycin, vancomycin, gentamicin are aminoglycoside antibiotics, and we need to monitor for ototoxicity and nephrotoxicity as well. Okay? Now, your letter B there, 33-year-old with stage 4 left ankle pressure ulcer who needs a wound culture. It may not really be an emergency or urgent situation. Okay? Letter C, you're looking at your potassium level. That potassium level is normal. It's 5. 5 is a normal potassium level, everyone. Okay? So remember that for hemodialysis. If it is critically high, like let's say 5.5, it's going to be like 6, then it's a priority. Okay? Or especially if it's like 5.2, it's already high, so you need to address that. Okay? Now we have your letter D, everyone. Your letter D, advanced lung cancer who reports that the PCA pump is not working. Of course, that's pain management. But always remember that pain management may not be the best priority in any situation like this. Always remember, follow your airway, breathing, and circulation, risk for infection, your safety, and then pain will be a priority if those situations are not present. Okay? So someone said, because, Lady Sam said, because ringing of the ears is a toxic effect. So you see, content is very important, everyone. And then when you look at this question as well, you really have to learn how to eliminate options. Okay, eliminate your options. Okay, so I think, okay, most of you got the correct answer probably. Okay, let's see. All right, so A is the answer. Now letter C is not the answer, everyone. Okay, so potassium level of 5. You really have to address first the question, the patient who is letter A. Okay, because you need to stop the medication. That's the answer. Okay, so let's proceed now to the second question, everyone. Okay, so that would be the answer to the first question. So let's see. We will have another prioritization question. So when you answer this question, I would like you to think that, okay, what do you think is the answer when you're sitting down in the NCLEX right now and you're answering this question? Okay, all right. So let's have the next question, everyone. And also, can you please put in your comment section your country or the state, okay, where you're located right now, because I want to find out our international students, okay, and also our national students. If you're from Long Beach, if you're from Los Angeles, if you're from, let's say, California, for example, I want to find that out, okay? All right, so we do have actually comments here. Okay, so we have Joe Balsky is one of our students in the online NCLEX Academy. Thank you very much, Joe, for being here tonight. Okay. Manjinder Kaur is also here tonight. Thank you very much for seeing you. Roxio Glow, thank you very much as well. Okay. All right. So I'll be looking at all of your comments, everybody. From which country are all you coming from? Okay. So let's have the next one. Okay. So we have from India. Manjinder Kaur is from India. Okay. Nice to see you here. Okay. All right. So let's have the next question, everyone. Prioritization question. All right. So let's have the question. Okay. The nurse is caring for several clients with respiratory disorders. Which of the following clients needs priority attention? A. The 35-year-old client with pneumothorax who has gentle bubbling in the water seal drainage system. B. The 26-year-old client who complains of chest pain that worsens with breathing due to pleuritis. C. The 47-year-old client with tuberculosis who developed yellowish skin discoloration after taking rifampicin. And letter D. The 56-year-old client who reports body aches, fever, and cough secondary to flu. Okay, so again, all right. The nurse is caring for several clients with respiratory disorders. Which of the following clients needs priority attention? A. The 35-year-old client with pneumothorax who has gentle bubbling in the water seal drainage system. B. The 26-year-old client who complains of chest pain that worsens with breathing due to pleuritis. C. The 47-year-old client with tuberculosis who developed yellowish skin discoloration after taking rifampicin. Or D. The 56-year-old client who reports body aches, fever, and cough secondary to flu. It seems like we have different answers in this question, so it would be interesting to find out, okay, who gets the right answer to this question, everyone. So who do you think among these 4 patients needs priority attention because something is going on wrong? Okay? All right? What do you think is the priority in this situation? I know you're always thinking of airway, breathing, and circulation, but always remember, I told you, be very careful about that. Okay? So which patient is in an emergency situation here, or is an unstable patient and needs immediate help as much as possible, or as soon as possible rather? Okay? All right, so we have people answering right now. So we have Trinity from Florida. Okay. Also from Albany, New York. Okay. All right. So let's see. Okay. What will be the answer to this question? I think some of you are still answering. I'll give you a little bit of time. Can you put your rationale? Okay. They're A, B, C, or D. This is a very nice question, actually. Okay. This is an analysis question. I really want to make sure that you know how to prioritize in this situation. Okay. All right, so let's see if you got the right answer to this question, everyone. We will find out, okay? This is prioritization question. And always remember, I told you that in the NCLEX, you will have questions on prioritization, right? Most of these questions will be given for patients, and you need to identify which patient is going to be a priority. So you need to know, okay? So the answer to this question, everyone, is going to be letter. Okay, so are you all excited, everyone? What do you think? Okay, the answer is going to be letter C, everybody. So letter C is the answer. And Manjinder Kaur said, rifampicin causes changes or red body fluids and hepatotoxicity. Okay, all right. So A, it should be gentle and not vigorous. Okay. So the answer is going to be letter C. Why? Number one, if the person develops yellowish skin discoloration or jaundice, that is not a normal side effect of rifampicin. Rifampicin is a medication for tuberculosis. And I always tell my students that medications for tuberculosis are mostly hepatotoxic. So with these medications that are hepatotoxic, it's very important to monitor the response of the liver when the medications are given. It's very important to check the liver function tests or your liver enzymes before starting your tuberculosis medications. So jaundice is an adverse reaction to rifampicin. We all know that rifampicin causes discoloration of body fluids, but discoloration of the skin, like yellowish skin discoloration, is not acceptable. So C needs immediate attention because we need to report this to the physician so we could stop the medication and do proper interventions. Okay? Now, why is letter A not the answer? A is not the answer because that is gentle bubbling. You know, one of the most important concepts I teach the students are the normal and abnormal findings and the troubleshooting and management of chest tubes. In the water-sealed drainage system, especially in the water-sealed chamber, it is expected to have gentle bubbling in a patient with ongoing pneumothorax because we are removing air. However, if it's continuous bubbling, then there is an air leak. So A is not the answer because A is expected. Okay? Now letter B. 26-year-old who complains of chest pain that worsens with breathing due to pleuritis. Well, inspiratory chest pain is common in patients with pleuritis because pleuritis is the inflammation of your pleural membrane. Okay? Pleural membranes. And then when the lungs expand, it causes pleural friction rub, and that's why there is chest pain. Okay, so letter B is expected in that condition. Okay, now letter D, the 56-year-old client who reports body aches, fever, and cough secondary to flu, those are symptoms expected of flu, so not necessarily a priority at this time. The priority is letter C. But what if I change the situation? What if I put in letter B that this patient has a pulse oximetry result of 80% only? Then it becomes a priority because it is oxygenation. Okay? So the answer to this question is going to be letter C, everyone. Okay? All right. So hopefully you got the correct answer to this question, everyone. Okay? So Rifat Tahira said, "Sir, I like your way of teaching. Thank you." Well, the way we approach the question is we first rationalize the correct answer. Am I right? And then after that, we go through each option why they are not the answer. Correct? Okay. So that's the approach. Okay. So everybody, let's see if we have other guests here. Okay, so thank you very much, Deborah May Thompson. So Deborah is one of our students for our Saturday class. So welcome to our online NCLEX Academy, to our prioritization delegation question tonight, everyone. Memi Lawal is also here with us tonight. Very good. Michelle Jimenez as well. So hopefully you will watch all of the other videos that we have on prioritization. We have done a lot of videos already, and some of these are available in YouTube. And then also in our online NCLEX Academy, we have the complete set of all Facebook Live recordings. So feel free to visit our online NCLEX Academy, everyone. Okay? All right, everybody. Are you ready now for our delegation question? Okay, so we have prepared delegation questions for you guys. Okay? All right. So the first question. The registered nurse is the preceptor of newly hired nurses. Which client may be assigned to the new graduate nurse? A. The 65-year-old client admitted for flare-up of systemic lupus erythematosus or SLE symptoms. B. The 36-year-old client with vaginal cancer who is undergoing brachytherapy. C. The 27-year-old client with MRSA pneumonia who needs intravenous antibiotics. Or D. The 67-year-old client who is scheduled for coronary angioplasty due to angina pectoris. Okay, repeat. The registered nurse is the preceptor of newly hired nurses. Which client may be assigned to the new graduate nurse? Okay. A. The 65-year-old client admitted for flare-up of systemic lupus erythematosus symptoms. B. The 36-year-old client with vaginal cancer who is undergoing brachytherapy. C. The 27-year-old client with MRSA pneumonia who needs intravenous antibiotics. Or D. The 67-year-old client who is scheduled for coronary angioplasty due to angina pectoris. So remember again our concept. When we are delegating, we have to make sure that we are delegating a stable patient. It has to be within the scope of practice of the person that we are delegating to. And it has to be, we also have to consider the scale of the person. And in this situation, it is a new graduate nurse, okay? New graduate nurse. So it has to be a stable patient within the scope of practice, within the scale of that person. Okay. So let's see what will be the answer to this question. So most of you are still putting your answers, everyone. All right. Okay, so make sure that you choose your answers carefully, everyone, and use the process of elimination. And again, it's very important to know your content, right? Your content. So do you know what brachytherapy is? Okay, can someone put in the comment section what is brachytherapy? Okay. So understanding these situations are important, or these treatments. Okay, so let's see who got the right answer in this situation, everyone. Are you sure of your answers, everybody? Okay. So Lady Sam said the patient is a stable patient compared to the other options. Okay. All right, thank you for your comments, everyone. We're giving a shout out to your comments. It will show in our Facebook Live and also our YouTube. So someone said, Dessa actually said that it is a form of radiation therapy, your brachytherapy. Okay, all right. So this question is a new graduate nurse, and in this situation, guys, it will be a new registered nurse. Okay. So in this situation, let's make it clear. This is a new registered nurse. So you can revise your answer if you want. In this situation, we are delegating to a new registered nurse, not an LPN, but to a new registered nurse. So you may change your answer if you want. Okay. Internal radiation, usually treatment for cervical cancer. Okay. All right. So you have your final answers, everybody. So let's see. What is the answer to this question? Very interesting. So you may have situations like this in the NCLEX, especially this is for RN question, when you are delegating to the LPN or to the RN. In this question, it is, let's say, a new graduate registered nurse. Okay, registered nurse. Okay, okay. So the answer to this question, everyone, will be, let's see. All right, so that would be letter C. Very good, everybody. So letter C. So the answer is letter C because this is a patient who needs intravenous antibiotics, and as a new graduate nurse, it is within the scope of practice and the skill of a new graduate nurse to be able to administer antibiotics. Okay, so it's a simple task and it's not really complex task that requires years of experience, and this is a more stable patient. It doesn't really identify or indicate there that the patient is unstable. Okay, so letter C is the answer. Okay, so let's have your letter A. Now A is not the answer because it is a flare-up of systemic lupus erythematosus symptoms. So flare-up, by the word flare-up, this patient is unstable because meaning the symptoms have worsened for someone with lupus. So A is not the answer. Letter B, vaginal cancer undergoing brachytherapy. Now, you have to understand brachytherapy is radium implant or radiation implant. And it is a complex patient, of course, because with radiation implant, you have to observe time, distance, and shielding. You want to make sure that you are not exposed to too much radiation. So we don't want to give this complex patient or treatment to a new graduate registered nurse, right? Your letter D, the 67-year-old client, coronary angioplasty. What is that? That is a procedure wherein we insert a balloon catheter to press or to widen the artery, the coronary artery. The fact that this patient is undergoing coronary angioplasty is an unstable patient because coronary angioplasty is usually indicated for patients with unstable angina pectoris, meaning the angina pectoris is not getting better, it's getting worse, unpredictable, and the pain is more severe. So that's why the answer to this question is going to be letter C because the rest of the other options are more unstable patients. Okay? All right. Okay? And letter C is an MRSA patient, and infection control is within the scope of practice of a new graduate nurse, wearing the right PPE in taking care of this patient. Okay, so within the scope of practice. Okay, so very good. And then Emma has a comment. So you have newly hired nurse is a novice and must be given simple tasks only, and also stable patient. So the answer is going to be letter C, everyone. Thank you very much for your answer, everyone. Very good. You got the right answer, everybody. So we're on for our last question for the night. So welcome, Mikey Fuentes. You're also watching us for tonight. Thank you very much for that, for watching us. Okay. All right, Menchi Maravilla. Hi, Menchi. We miss you. Menchi is one of my students in the online academy. Pushpa Pandey is also watching. So I'm giving you a shout out. Thank you for watching. Anusha Sara Sebastian. Thank you also. Okay, we have Farid Ali, Chika Anya, Cristel Yanzon, Hyacinth, Nasibog, thank you very much for watching. Myra Cruz, Romisha, Caitlin Bass, and Brittany Sarni. Thank you very much for watching and being here tonight in our program. I hope you enjoy our program. Okay, we do have Carlos Garcia, Roselovex, Michelex, and Make Macon Icon Boncolmo also. So thank you very much for watching here tonight. Okay, I really appreciate that. All right, so I hope you are learning tonight, everyone. So we are now going to have our last question for tonight, everyone. So let's see if you can answer this question for tonight, everybody. Okay? All right. So let's proceed. All right. So I like your teaching, sir. Thank you very much, Sailila, for your appreciation. So we will have the last question for tonight, everyone. Okay, this is a delegation question. So let me read the question. The registered nurse works with the unlicensed assistive personnel and licensed practical nurse in caring for clients in a medical surgical unit. Which of the following tasks can be delegated to the LPN? Select all that apply. A. Administer warfarin for atrial fibrillation. B. Evaluate the lab results for change in condition. C. Teach client on the purpose of intravenous fluids. D. Place soiled linens in the hamper. E. Auscultate breath sounds every 4 hours. Or F. Flush the central lines with normal saline every shift. So again, the registered nurse works with unlicensed assistive personnel and licensed practical nurse in caring for clients in the medical surgical nursing unit. So which of the following tasks can be delegated to the LPN? Select all that apply. A. Administer warfarin for atrial fibrillation. B. Evaluate the lab results for change in condition. C. Teach the client on the purpose of intravenous fluids. D. Place soiled linens in the hamper. E. Auscultate breath sounds every 4 hours. Or F. Flush the central lines with normal saline every shift. So let's see what's your answer for this question, everyone. Okay? Again, remember the scope of practice of the LPN. Okay? What are the things that an LPN can do? Okay? Question is, can the LPN do sterile procedures? Can the LPN evaluate labs? Can the LPN give warfarin? Okay? So in this question, we're not delegating to the LPN clients. We're not delegating clients. We are delegating tasks. Okay, tasks meaning things that the LPN can do. When we are delegating to the LPN, if you're the RN, then you have to choose a stable patient. However, in this situation, it's not about having a stable patient. This question is about task. What can the LPN do? Okay, so select all that apply is the question. Okay, so the question is, what can be delegated to the LPN? Okay, all right. So it seems like all of you have your answers already, everyone. Okay, let's see. Okay, so make sure that you know the scope of practice of LPNs. All right, so let's see, everybody. All right. Okay. So that's the answer, everyone. Okay. So in this question, the registered nurse is delegating to the LPN, right? So in this question, everyone, the LPN, A is the answer because the LPN can actually give warfarin for atrial fibrillation. That is possible, okay? That is within the scope of practice of the LPN. Your letter E, auscultate breath sounds every 4 hours. That's also within the scope of practice of the LPN. You need to remember that. Because LPNs, as what we have said before, they can do focused assessment or specific assessments. They can auscultate breath sounds. They can listen to bowel sounds also. Okay? But LPNs cannot monitor unstable patients. Okay, but they can get vital signs too, although routine vital signs should be for the UAP, routine vital signs of stable patients. But the LPN can do specific assessments. Okay, check the heart rate, check the bowel sounds, check the breath sounds. Those are specific assessments. Okay, so let's look at the options. B, evaluating the lab results for change in condition is the responsibility of the RN. Okay, remember we do not delegate it. Evaluate, assess, and teach, right? Interpretation, analysis, and evaluation of lab is within the responsibility or scope of practice of the RN because that requires complex thinking. Now, letter C, teach the client on the purpose of IV. Remember that teaching is the responsibility of the RN. Okay? Now, D, placing soiled linens in the hamper. That's a task that can be delegated to the UAP. Okay? Letter F, flush the central lines with normal saline every shift. Remember that LPNs cannot flush central lines. Central lines are invasive, central venous lines, and the LPN cannot manage those lines, especially flushing everyone. Okay, so in general, so that has to be the registered nurse. So that would be A, and that would be letter E for this question. So I hope you got the right answer. So Jemlyn said, central line is not within the scope of practice of the LPN. Very good. Okay? All right. And then someone said also, administration of warfarin can be done by the LPN as warfarin is orally given. Okay, very good. So I hope, who got 4 out of 4 for tonight, everyone? I would like to know. Okay? And, okay, what is the best thing that you have learned tonight, everybody? Okay? What is the best thing that you've learned? So Amber Liu said 4 over 4. Congratulations. But Amber Liu actually already passed her RN, right? Your license. Very good. Okay? All right. So, let's proceed now to another one. Before we end for tonight, of course, I just want to give a shout out. Okay? A shout out to our special, okay, online NCLEX Academy. So our workbook is 9450. It's a very nice workbook. If someone can comment in the comment section if you like the workbook, guys. And then we have the monthly subscription to use your workbook at $49 per month. Okay? All right. So that's going to be $143.50. Okay? And also one thing, everyone. For this month, it's December. We may have new promos again upcoming in December 25 for Christmas and until New Year. So watch out. And as what I've said also earlier, my book in Amazon, we will be able to probably sell my book, a signed copy of my book, and we will post the website in the Facebook. So if you want to have a signed copy, let me know. You can email me, and I could give you also and then I could send you a bookmark together with that book also, a colored book. Okay, all right. So, okay, so everybody, thank you very much for being here tonight. It's time now to announce, okay, our winner for tonight. If you do have any questions, put that in the comment section or you send us a message. Either me or my staff will answer your inquiries. Okay? All right. So Darcy said, best book ever. Thank you very much, Darcy. Thank you. Okay. And also Mulu said she likes the book as well. So she has my book. Okay. So Emma said, always exciting and very helpful. Thank you, Emma. Okay. All right. So the winner for tonight, everyone, get ready, everybody. The winner is the Jimmy Al-Haji. So the Jimmy Al-Haji is the winner for tonight. So the Jimmy, please send us an email so that we can enroll you in the program. So send us an email immediately. Okay? All right. So hope that you learned something tonight, everyone. Okay? And Gislyn Paul has my book and workbook. And also remember, everyone, okay, my book and my workbook have the same contents. It's just the format that is different. Okay? So give your congratulations to the Jimmy Al-Haji, our winner for tonight. And again, thank you very much, everybody, for being here. My name is Mr. Alan Matus again. And also last week, I posted a podcast interview with Christopher Kai. So if you have not listened to my podcast yet, interview, then I'll put that in the link as well. And again, The purpose of my program is always to make learning simple, fast, and easy. And that's why we develop all of these programs, everyone. Okay? Because studying for the NCLEX is overwhelming, a lot of information. So I'm very happy that I was able to create a program that is simple, fast, and easy to learn your nursing concepts before the NCLEX. Even if you graduated 10 years ago or 20 years ago, you can still pass your NCLEX. And always remember, everyone, okay? Always remember that you can pass the NCLEX. So think positive. Have a good night, everybody. And I'm so happy to see you here tonight. Okay? Good night, everyone.